human body. We generally breathe and breathe out at a normal. What is our peak inspiratory demand is 35 liters per minute. We inspire, expire, right? Inhale, exhale. So let's see that how trachea works during the exhalation or inhalation. So we can see here, these are the hair-like structures जो debris को ऊपर की तरफ धकेल रहे हैं. Okay, so this is a inner layer of our trachea, or you can say this is a ciliated epithelium which is present inside the air tract. So which is act as escalator. हम जब कभी एयरपोर्ट में या you can say रेलवे प्लेटफॉर्म में चलते तो एक जगह पे खड़े रह के वो अपने आप है ना कि जमीन चलने लगी, मैं एक जगह पे खड़ा रहा. ओके, सो सेम वे इट वर्क्स. जो भी डेब्रीज है, जो भी फॉरेन पार्टिकल्स है, वो वॉश आउट करने के लिए ह्यूमन बॉडी यूज ciliated epithelium. These are the cilia, hair-like structures, and above that there is a mucus layer. Okay, so ciliated epithelium includes cilia and goblet cells. Goblet cells produces mucus and cilia transport it to the upward size. Okay, understood? यहाँ तक सबको मालूम पड़ा? Yeah. Now let's talk, as we said, why it is so important. At the optimal humidity, the clearance is maximum. Secretion is just a zero. But when we reduce the absolute humidity or humidity, it starts mucusing inside the layer. The layers getting formed. But जब जैसे जैसे हम नीचे आते हैं, जैसे जैसे 30 लीटर पर मिनट पे आते हैं, we can see secretion layer is dysfunctions. पूरा dry out हो जाता है. Okay, so that is the reason we are giving optimal humidity, and that is the reason when we use HFNC, at that time we are giving a optimal humidity. Okay, so now I'll just quickly give you the one video that how it works or how. Yeah. So here there is a 100% humidity. Optimal humidity is there, and in this part only 10% humidity is reduced for 10-15 minutes. So this is a cross-sectional part of trachea of sheep. Okay.
The impact of reduced temperature and humidity on mucociliary transport is shown very clearly in this experiment, which compares the behavior of two tracheal samples. The first, on the left, is at normal humidity. The mucus layer will dry out. According to the air was supplied unidirectional airflow has on both cliffs at this stage.
So these are the cilia.
The right
जो debris को upwardly escalate कर रहे हैं.
Dark spots.
लेकिन we just reduce the 10% humidity. We can see here that the debris is getting deposited on airway tract. So this is at the last stage, as I said, 30 liter or 31 degree. So that was the total dry out of the trachea. So we can imagine the patient when patient says that ma'am पानी दे दो, right? And you are the frontliners where patient बोलते हैं कि ma'am थोड़ा सा पानी दे दो. This is the reason why patient asks continuously कि ma'am पानी दे दो, क्योंकि जो airway tract है वो dry out हो जाता है due to cold and dry gas, right? Now coming back to the presentation. Let's start with the high flow HFNC. So as I already presented it here only, so it is also called as high flow बोलो nasal cannula, or it is also called as triple HFNC, heated humidified high flow nasal cannula, because we are providing heated एक्टिव ह्यूमिडिफिकेशन, ह्यूमिडिफाइड हो रहा है, उसके हाई फ्लो के साथ हम लोग प्रोवाइड कर रहे हैं. ओके, सो इस एग्जांपल एक एग्जांपल लेते हैं कि हम लोग थोड़ा सा बाहर घूमने गए फोर व्हीलर में, और कोई हम लोग देखते हैं ना कि कभी वो ऊपर की तरफ क्या होता है जिससे हम बाहर आ सकते हैं, सनरूफ, राइट. सो जब सनरूफ से बाहर आते हैं और we see that the car is driving with a speed of 80 or 100. Can we tolerate that flow? Can we tolerate? No. Same way we are giving here a 60 liter or 50 liter flow to the patients. Same way. And as this is a cold or dry gas we are inspiring, इतने जल्दी ना वो ट्रैकिया जो है वो ड्राई आउट हो जाएगा. That's why we are using active humidifier with it. Now, what is high flow nasal therapy? It is a type of respiratory support that delivers high flow of blended humidified air with a supplementation of oxygen. Are we giving a 100% pure oxygen to the patients? No, we are blending with the room air. So that will not also cause the poisoning of the oxygenation. Okay, so let's start with the mechanism of it. So there are mechanism that which works. First, it gives respiratory support